A very warm welcome on behalf of the School of Public Health at the Jackson State University. We will be in this section. What I'll be doing is I'll be discussing some of the aspects of publishing a peer-reviewed journal article based on the data that you've collected, based on the research study that you have done. I want to tell a little bit about our new School of Public Health at Jackson State University. It is one of the first schools of public health in the state of Mississippi and the first one at an HBCU. And we are accepting applications for the Doctor of Public Health program starting in fall of 2018. So please avail of that opportunity and apply for this program, which has been in existence for the past 10 years or so and is accredited by CEF. So the first and the foremost important thing in a paper is the title, because this is the thing which people would search for, would look for your article, would read the article. So this title is the main thing in our article, and it should capture the main idea. It should be a standalone in itself, meaning that it should convey the whole gist of the article. So it should neither be too brief nor too long. The APA style, which many journals, like the journal that I edit, the Journal of Alcohol and Drug Education, allows for 12 words in the title. NIH allows a total of 56 typewritten places. So there are restrictions, and within that restriction, we have to be clear about the main idea. So the title must include the independent variable, which is also known as the explanatory variable or the predictor variable, and the dependent variable, which is the outcome variable. And then it should also include a description of the target population. So these three things should be there in the title, ideally speaking. So an example of a title is Role of Religion on Patient Satisfaction Among Blacks in Mississippi. Now, religion here is the independent variable or the explanatory variable. Patient satisfaction is a dependent variable, and African Americans in Mississippi are the target population. So that is the whole thing about the title that we need to keep in mind. And then the second most important thing is the abstract, because once again, during search, oftentimes the abstract of the article is provided. So this abstract is composed only after you have had a chance to write the whole article, and then you compose the abstract. It can be unstructured or structured. Some journals in our field, like the American Journal of Health Behavior, has a structured abstract in which you have to write the objectives, methods, results, conclusions in just 100 words. Some other journals have unstructured abstracts, like the International Quarterly of Community Health Education, that has an unstructured abstract of 150 words. So different journals have different requirements, whether they are structured or unstructured, and there is a word limit. So you need to pay attention to the guidelines of the journal in which you are writing. So the abstract usually starts out with one sentence or so about the background, and then the objectives are or the purposes are written very clearly. They should once again include the independent variable, dependent variable, the target population. And then you write the methods in which you describe the design, the sampling, the sample size, instrumentation. And sometimes in health education, we have interventions. So we describe in one or two sentences the intervention. So everything has to be very tight within the word limit that we have. And then the results section should highlight the inferential work with the p-values or the estimation by 95% confidence intervals. And in qualitative articles, you can just highlight the key findings. For example, you are doing a SWOT analysis. So the SWOT would be the results, the strengths, weaknesses, opportunities, threats. And then conclusions, they must underscore the key learnings. Now, sometimes for the new students, they would include references in the abstract, and that should not be done. Abstract is always done in one's own words. So it has to be, no references need to be included in the abstract. So now we come to the main text or the main body of the article, which usually starts with an introduction. So you start by identifying the specific problem area, and that should neither be too broad nor too vague. And then you want to establish the importance of the research area, which is usually done by statistics and epidemiological data, the descriptive epidemiology, those kind of things. And then the research studies, some of them are atheoretical, but good research is always theoretical. It builds on existing theory. So you need to elaborate which theory you are operationalizing in your research study. And you can organize your introduction in topics, subtopics instead of citation to citation. And you should emphasize cohesion, synthesis, transitions, all those aspects of writing need to be kept in mind. And all factual statements must be referenced, preferably with recent and primary sources. Primary recent means within the last 5 years or so, and primary means which are the data-based empirical studies, rather than someone else has cited something, that should not be done. So it should be, as far as possible, primary sources. So that's how you compose the introduction. And then we come to the second section of the manuscript, which is the methods. And the methods start with discussing the design first. And we've already seen that the various designs are like the cross-sectional design in health education. Sometimes in epidemiological studies, we have the retrospective observational case control design, or the prospective observational cohort design, or the quasi-experimental design for interventions, where we have the non-randomized comparison group, or the experimental design, in which we have the random assignment between experimental and comparison control groups, and we have an intervention. So these are the common designs we use in health education literature. And then the rationale of the design should be mentioned, like what are the advantages and what are the disadvantages, and you should highlight the advantages over the disadvantages for choosing that particular design. And there should be a clarity of the dependent variable and the independent variables in describing the design. So that's the first part of the methods section, the design. And then the next part comes to the population description and the sampling, the sample size. And these days we are using G power for calculation of the sample size, which is becoming more and more common. The samples in health education can be probability samples or non-probability samples. Sometimes we have non-probability samples, especially if we are doing theory testing or we have interventions. Then we choose a convenience sample, which is okay. And then for qualitative research, we use convenience sample focus groups, purposive sampling, as it is called. So those are all non-probability samples. But if we have the purpose of generalizing from a survey, then we use various kinds of probability samples, like the simple random, stratified random, systematic random, cluster sample, or the multi-stage sampling. So you describe the sample and the sample size in this next section of the methods. And then we need to describe the instrumentation in full detail. And first of all, the kind of instruments that we use are either self-report or observational. Sometimes we use physiological measurements like blood pressure or cholesterol, or those kind of things. So it is important to talk about the psychometric properties of validity and reliability. Usually we have the face validity and content validity, which should be spelled out, which is done by a panel of experts. Construct validation, which is done by confirmatory factor analysis or structure equation modeling. And then criterion validity, if you are doing a comparison with an existing measure, then that is done. And then the information about reliability. Usually we have internal consistency of all the subscales and the entire scale by Cronbach's alpha. We have test retest reliability or stability, and that's a Pearson product movement correlation coefficient done between the test and the retest scores. Sometimes for observational tools, we have rater inter-rater reliability. So all this should be described. And Dr. Jamerson edits the Journal of American Journal of Health Studies, and they invariably require the instrument to be added as an appendix. So that is something nice about American Journal of Health Studies, that they require that the instrument be added in the appendix, which sometimes because of the constraints of space, some journals don't include. But that is very good, and you should include that as an appendix if that's a possibility. And then in terms of the methods, if you have an interventional research, then you describe the intervention by telling about the experimental and the comparison interventions in sufficient detail. They should be just like a cookbook, but of course there are limitations of space, so you cannot go in complete detail, but as much detail as you can provide, you should do it within the constraints of the word limit and the other requirements. And in this description, you should talk about the behavioral objectives of the intervention, the learning objectives, the educational methods, the activities, duration, and the process evaluation method if you've used that. And then the results section in quantitative research, you have to link up the various findings in the form of tables. And usually 2 to 4 tables are included. 1 or 2 are descriptive tables in which you describe the demographic variables and the study variables. And 1 or 2 tables are analytical, like the multiple regression or the analysis of variance, those kind of things you include in the analytical tables. And for descriptive statistics, you can summarize the frequencies and percentages for categorical variables, means, standard deviations, and correlation coefficients for the metric variables. In the inferential tables, you should provide the p-values or the 95% confidence intervals. And they should not contain any interpretation of findings. Those should be saved for the discussion section. In qualitative research, we are interested more in attributes of trustworthiness, or how much the researcher has adhered to the chosen method. So that should be described. Auditing of the research by independent people, if that has been done, that should be included. Member checking by the participants is very important. That should be included. You should include direct quotations from participants. Sometimes we use multiple methods, especially mixed methods. So triangulation, that's called as triangulation, that should be described. Attention to the coherence between the various facts and things that you present, and the transferability, which is like generalizability, but not exactly generalizability, which is the similarity of research situation with other similar settings. So that should be described in the results for qualitative research studies. And then comes the discussion section. The discussion section, we start out by recapitulating the purpose of the study and then highlighting the key results at the beginning of the discussion. And then we link the findings with the cited literature in the introduction and with the theory. So that is done with linking up the findings. And then we provide implications for future research. We provide implications for practice. Some of the journals like Health Education and Behavior, they have a special section called Implications for Practice. You have to write that section as a separate thing. And sometimes we also have implications for training of professionals, for policymakers, for the target population. So those implications should also be underscored. And then there is a section on limitations of this study. Like, for example, if you've done a cross-sectional study, the cross-sectional design, which is a snapshot, that is a limitation. Or the self-report, if you've used, those have limitations. So you need to underscore some of the methodological limitations in the discussion section. And then final section is that of the conclusions, and you can have a subheading for conclusions, or you can write it in the discussion section itself. And this is the take-home learning from this study. These should be made very, very explicit for the reader, and the reader should not have to make effort to find out what the conclusions are. And one has to keep in mind that the conclusions should not go beyond the data. They should be based primarily on the study that one is doing. Thank you very much.